And both these tensions, I think, reflect false choices. The either-or choice, that you either focus on COVID or you focus on the next pandemic, or that you either focus on building up existing institutions or you build up multilateralism. Those are false choices. We have to build both. We have to address COVID urgently, and we have to address with urgency as well the preparations for the next pandemic, and indeed the need to build up public health systems in the interim. We have to focus on building up multilateralism, and we must make the most, and we must enhance the roles of the existing institutions. It's not an either-or. So when we think about our governance mechanisms, when we think about the new financial facility that has been proposed, and I think President David Malpass put it extremely well when he laid out those principles for the FIF. The FIF is not just about preparing for something in a distant future. What we do to use the FIF will have immediate utility in a continuing COVID pandemic. It will have utility in building up public health systems and addressing chronic diseases after we are past COVID-19 pandemic. And it will, of course, be critical in preparing for the next pandemic. The highest rate of investment and the greatest cost effectiveness is going to come in initiatives that address all those three things together. First, dealing as much as we can with the continuing COVID pandemic so as to shorten it and bring it to an end as soon as possible. Dealing with chronic diseases and improving public health once we are past this pandemic, and preparing for the next pandemic so we never again see the cost that we've seen over the last 2 years. And each of the users of the FIF, each of the users of the new multilateral facility has to reflect that triple objective of having immediate utility, having utility beyond this pandemic, and preparing with much more robust capacities to be able to avoid the next pandemic, and if it does come, to be able to sharply reduce its costs. Each of the basic users, what are those basic users? First, surveillance, are clearly critical, and I support very strongly Indonesia's proposal for a global genomic data sharing platform. Absolutely critical. It starts with local population level epidemiological monitoring systems. It requires regional and global genomic sequencing capabilities. It requires data sharing. It requires a major step up in the entire network, building on existing hubs as well as strengthening new hubs. And the WHO hub in Berlin clearly will be playing a central role. But we are nowhere near having built out that global surveillance network. So that's critical, and will be of immediate utility because we are going to get more variants in COVID. We're going to be able to have to assess the effectiveness of vaccines continually. The game is not over yet, even in today's pandemic. So we are building for the future, but it has immediate applicability. That's the first use, surveillance. The second critical requirement, which a FIF will have to help catalyze, is in building out the manufacturing capacity globally for diagnostics, vaccines, and therapeutics. And again, the Indonesians, building on the Italian presidency, have put forward a cogent proposal, which we have to develop. That's been the big lesson of COVID. The big lesson of COVID is that if we're not prepared in advance of a pandemic, it's too late. If we're not prepared with the capacity in advance of a pandemic to manufacture at speed and scale the vaccines, the therapeutics, the diagnostics, the PPEs, and so forth, it's too late. We'll have a much longer pandemic with a great cost to nations rich and poor, and it's just an unacceptable human cost as well. So we must build now the capacity with immediate use in COVID-19 itself, particularly when you talk about vaccine manufacturing capacity, but we must think beyond COVID as well about its uses in normal times, where we have a whole set of chronic diseases that still plague a large part of the world's population. The technologies have now progressed where we can use the facilities that we are putting in place now, build them out further, use the new technologies to be able to address not just the disease we've just had and we are still having, but existing chronic diseases as well. And the mRNA technologies and other new technologies are allowing for facilities that can address multiple diseases. And that's absolutely critical. And not just vaccines, but also therapies, including long-acting injectable therapies. The technologies are progressing. So it's extremely important that we think of the manufacturing capacity in those terms. Do as much as we can with urgency to build out that capacity for continuing COVID pandemic. Use that capacity as fully as we can beyond this pandemic to improve public health and address the critical needs of populations which are still plagued by chronic diseases, and build that capacity in advance of the next pandemic. That's the second major use of an FIF. And the third major use, which my colleague Nirmala Sitharaman highlighted as well, is really building country and regional level preparedness. And what we do today has to be part of how we improve tomorrow. Everything we do, building up the trained manpower, the cold chains, the communications channels, the digital data sharing infrastructure, everything we do today is not just for today, but it's also what we've got to keep using after this pandemic, and is what we really have to have in place before the next pandemic. Finally, just let me say that the other either or we have to avoid in our minds is this idea that we either focus on existing institutions, existing global health organizations, or multilateralism. It's not an either or. We need to build up both, and they have to complement each other. The existing organizations perform an extremely useful role in disease surveillance, in infection controls, in a whole set of for a whole set of diseases as well as a whole set of interventions. But it is a siloed landscape. We all know that. It's highly fragmented. And as was mentioned by one of our colleagues in the previous panel, fragmentation has been the big lesson coming out of COVID. We were too fragmented, and as a result, we found it very hard to organize in time, to raise adequate resources in time, and to deploy effectively. We've got to do much, much better the next time round. And it means not just building up and enhancing the roles of the existing organizations, but we have to strengthen multilateralism. We must strengthen multilateralism and do it in a way that complements the existing institutions, catalyzes funding for the existing institutions, as well as attracting new funding from philanthropies as well as from governments. It's critical that we follow those principles that David Malpass highlighted earlier on when we think about the FIF. Simplicity of governance, not duplicating existing funding, but complementing it, becoming a value add on the system. And I believe it can be done. And the better we achieve that complementarity, the higher will be the return on investment. The higher will be the return on investment in terms of social returns. So even if we're talking about grants, it's really the social returns that we want to maximize. Let me just say in concluding, and again, I say this because I've been watching very carefully the discussions that take place at multiple levels, the more junior officials, the deputies, the ministers, and so on. Many of us are finance ministers or former finance ministers. I would just say we need a sense of financial realism and responsibility in all of this. To say that we don't have enough money to invest for the future is, to me, as a finance minister for many years, something that's going to cost our own taxpayers a lot of money. A lot of money. Because if after everything we've been through and the costs we've been through, human and economic, we say that we don't have the modest resources necessary to prevent the same thing from happening in future, is an extremely costly position to take for us as finance ministers, quite apart from being morally irresponsible. So we have to make these relatively modest investments, pool our resources together, and make these investments in the future, and think in investment terms. This is not just spending. It's an investment. And as Robert Speranza, our Italian colleague, said in an earlier panel, as the HLIP had set out last year, the amounts of money required compared to the cost of the future pandemic, even on conservative assumptions as to what that cost will be, you're really talking about 700 to 1. the cost will be 700 times larger than the amounts of money required each year for us to put up in additional international financing. So it's a compelling financial case, and we need that sense of financial realism as well as financial responsibility. And I know the domestic problems many countries face. We all have domestic problems. We have to put aside money for the future that's not for immediate benefit, but is going to be of great benefit to our populations. One of the purposes of a multilateral mechanism, both a governance mechanism that brings together finance and health ministers from an inclusive G-20 plus group, plus an FIF, a multilateral financing mechanism that as many countries as possible contribute to. One of the advantages of that is that it helps us in our domestic narrative as well, because we all play our part. We all play our part by pooling resources and investing in the future, and it's easier for us to do it in many countries if we are doing it multilaterally. So let me just end there. I think to borrow my good friend Nirmala's metaphor a short while ago, we can have our hearts in the right place, and we can join together our hands to not only save a lot of lives in the future, but to improve the quality of life in normal times as well. We can do it. It's affordable. It's doable. Thank you.
That capacity, and we need to be able to use all the existing resources and also financial institutions that are existing right now. But going back to Secretary Yellen to just give also an overview on a collective tone, like how Secretary Yellen, you have a remark that you would like to give as well that you would have given initially in the first session, but how can everybody wins and get the financing support needed while also ensuring fairness in the process, for all countries, both the donors and also the recipient countries, Secretary Yellen?
Well, I think the work of the high-level panel presents us with a road forward that will meet all of those objectives. A multilateral mechanism for health and finance collaboration, which is something that was clearly missing before COVID-19. I think the G20 Finance Health Task Force is a good starting point to explore more systematic and formal cooperation. This is a mechanism that will allow finance and health ministries from around the globe to come together to discuss issues related to pandemic prevention, preparedness, and response. It will be a collaboration that will be critical in detecting and containing the next deadly pathogen so it doesn't spread to become a regional or global pandemic, with the devastating impact on our people and our economies we have seen this time. So it's a mechanism that will help us synchronize health policy prioritization and finance decisions, and I think bring in voices from regional groups, from diverse and often underrepresented perspectives to the global conversation. And we complement that by creating this financial intermediary fund that will mobilize the funding that we need, that my colleagues have described, to fill the financing gaps that exist in the current architecture. And I think following the recommendations of the high-level panel, we're going to be able to do a great deal to address vulnerabilities relating to future pandemics. And I think it's important that the global community come together in the far-sighted way that Tarman has just described, to make sure that we don't suffer the enormous health and economic consequences that the COVID-19 pandemic has caused the globe.
Thank you, Secretary Yellen. There was also a remark that you would like to give.
That's fine. I'm good.
Okay, thank you. Thank you for that. So moving on to Minister Sitaraman, when we talk about better coordination, stronger coordination, you also believe that, a stronger coordination between health and also finance decision makers is one of the elements that would support a stronger global health system. What outcomes do you hope this stronger collaboration and coordination will produce when we take into account, the perspective of the lower and middle income countries?
As we all have been talking about, trying to maximize the available resources within a country, commit oneself for today's pandemic, and also look at investing for future preparedness. And in that, out-of-the-box ways of thinking, and also looking at blended finance, where the resources that are available for you within your country become catalytic fund, because this way we will be able to address issues which are related to small and medium income countries. When you look at using their own fund as catalytic fund and look at public and philanthropic funds going into it, create the catalytic effect and mobilize additional private sector funds, you are able to come up with funds enough to take care of future investments. Thurman constantly refers to it as very modest, which is required, modest fund which is required. Otherwise, the offset for it is not really much. But what the future cost will be otherwise is quite high, is a point which all of us will have to look at. And then also hope that IMF's new SDR allocations, which were essentially used earlier and also would also be used now to help low-income countries so that they can invest in their own health systems and for related expenditure. But the preparedness aspect of what we are experiencing now raises serious concerns, because when we were dealing with the pandemic, the kind of common pool resources that we had to gather, mobilize, and then redistribute for the low-income countries were very basic things which are material for healthcare, good healthcare, whether they were syringes or PPE kits and so on. So for a future pandemic, that's the kind of preparedness we should have, particularly keeping the low and middle income countries in mind. Nothing which will be simple can be excluded. At the same time, nothing that which is going to be far from being affordable can be rejected for them. So we'll have to have a pool of things readied so that a future pandemic doesn't ignore simple things, nor does it overprice the very complicated or very expensive items, so that the middle income countries or low income countries don't get the worst for it. So we need to have a preparedness which is transparently managed, which is multilaterally supported, because eventually all this will have to be done through multilateral institutions. And therefore, the WHO's centrality is not being undermined at all. But yet, even WHO's own ways of doing things and also mobilizing capabilities need strong augmentation. And that is what is going to help us help those countries which cannot help themselves when such crises related to the pandemic or even climate crisis take place. So that is the way I would think we can all stand up together to help in emergency situations of health and climate.
Thank you. So to President Malpass, then, when we talk about this new mechanism, how would, when we talk about emergency situations that was mentioned just now, how do we ensure that the new mechanism will offer quick and also unbureaucratic process to financing in the event of another major outbreaks, since timely response is also essential, President Malpass?
Of the new fifth, as Secretary Yellen said, the goal is to mobilize funding to help fill the financing gap. And part of that financing gap is the short term, the immediate need in the event of a crisis. World Bank has tools that I described for that, the IDA front loading, for example, and the IBRD cushion, and also the CAT DDO bonds, which are all very important. And I think new innovation of short-term financing mechanisms is also possible through the fifth. If I may, also as part of this, it will be important to have a focus on what the preparedness is. We work with countries now on how they can set up their systems so that they can respond to crises. And it turns out to be a difficult and challenging endeavor for a lot of countries due to the capacity constraints, to mention one of them. So I would say that we need to think about country platforms that pull together the best efforts of various multilateral institutions working with countries that are really trying to move forward and do the preparation that's needed. That would be an important mechanism of the new fifth.
Moving on to Senior Minister, then to add on that, when we talk about the new financing scheme and also mechanism, I mean, how do we ensure fairness? I would be asking you the same question as well. You've identified gaps in building resiliency, especially in preparedness for future pandemics, but also to end the COVID-19 crisis right now. So when we talk about distributing resources and also in terms of the donors and also the recipient countries, how would you quantify fairness? How would you do it? How do we get the accountability to make sure that, as you said earlier, that the cost incurred in the future will be much lower than the investment that we are making right now?
To me, we think a lot about fairness. That's been a critical issue in the vaccine distribution system. But it means it's a complex issue when you have different types of vaccines. So what we think is important in measuring fairness is, do individual countries have access to the types of vaccines and to the therapeutics and to the deployment systems that work best in their countries? So as you think of a health preparedness system for the long term, it's going to be very different in different countries. So you can't measure fairness by in the form of identical in each place. Or what you can have, I think, is a basic checklist. What is necessary for a country to be prepared, and then you can build from there.
Very well then. I think we have another round for a last remark from all His Excellencies or Her Excellencies that are present in this session. First, I'd like to give the opportunity to Secretary Yellen to give her last remarks concerning this topic. What would be your expectations moving forward, Secretary Yellen?
Thanks very much for that question. In concluding, let me just emphasize the tremendous importance that I attach to both focusing on being prepared for future pandemics by establishing and getting up and running quickly this Global Health and Finance Ministers Task Force. At the same time that we continue to have urgent need to address the current pandemic, we really need to learn the lessons that it's taught us to do what we need to do to be prepared for the next one, so that its toll, its human toll, and its economic toll is not as large as this one. This is such a worthwhile investment, and a financial intermediary fund will be a very critical ingredient in making this work.
And moving on to Minister Sitranaman, the same question to you. What would be your expectations moving forward?
It's apparent now from all that has been discussed from the morning and even in this panel that investment should happen now for a safer future is agreed upon. I agree with Mr. Malpass on the fact that basic list should be there, a checklist of what is absolutely necessary for all countries, particularly the poor and the middle income. So unless that checklist is ticked off by each of the countries, we wouldn't serve their requirement, and that has to be done speedily. And that is where some work has to be readied. Even better will also have to be the second silo, that is, even better would be to make sure that the financing modalities are absolutely based on sustainable and viable principles of sustainability and viability, and that the independent governance takes over the moment these funds are mobilized and something is there in the kitty for us to deal with it, for getting vaccines or everything else distributed to the poorer countries. We need to have an independent governance mechanism, even if they are located in multilateral institutions, and keep principles of inclusivity, transparency, and equity in mind. And then the shortfalls will have to be every now and then filled up. And finally, increased funding would be needed from multilateral development banks, resilient and sustainability trusts being created by the IMF must keep pandemic preparedness in mind. And therefore, the principle being agreed upon investment, looking at addressing fairness, and also financing modalities being well established so that they have inclusivity, transparency, and equity in mind.
Very well, thank you for that. And to President Malpass, any last remarks?
I was listening carefully to those two learned remarks, and I will to Tharman. And so my only thought is the funding is important at this point. The mechanism can be set up, but it's what we are dealing with in this pandemic is the recognition that quite a few countries were unprepared and didn't have the capacity to build even through a 2-year-long pandemic. So we want to work to avoid that situation in the future, and that's going to take sizable funding and a new mechanism, the fifth, in order to do that. Thanks.
Very well, thank you for that. And also to Senior Minister Shanmugaratnam.
Well, I think just to add to what's been said, after everything we've been through, we know that the requirements to avoid the next pandemic will have to involve more than incremental change to existing institutions, but neither is it necessary for us to have to work on a grand reconstruction of the whole system of multilateral cooperation. We have to strengthen the existing organizations, and we have to build new multilateral mechanisms to ensure complementarity between them and to enhance financing. That's our approach. It's not a whole reconstruction of multilateralism. There's no solution that does not involve a stronger WHO, reformed, empowered, and critically with more financial security, more predictability in its funding. There's no solution to strengthening global health security that does not involve a stronger WHO. There's no solution that does not involve making the most of the other global health organizations, which have very valuable capabilities. And there's no solution that does not involve a new multilateral mechanism, both to coordinate between finance and health ministers, as well as through the FIF, to respond with agility, to prioritize across the system, a fragmented system, to bring it together. So that's a significant strengthening of multilateralism when you put it together. It's not a grand reconstruction. You're not turning everything upside down. But we have to think in more than incremental terms. And as Minister Sitharaman pointed out last year in Rome, let's not let bureaucratic inertia and all the intra-bureau squabbling get in our way. We've been through an immense crisis. It requires significant change. We can reform the system, and we must.
Very well. Thank you for that. In conclusion, that was a very powerful message. We cannot stay the same. We have to make changes, and the changes can be incremental. But at the end, we need to be able to come together because in conclusion, this COVID-19 pandemic and any other future pandemic requires for the global community to come together and also act together while making sure that nobody is left behind. And as the lesson learned throughout this pandemic COVID-19 is, I think it is not over until it is over for all. So, and this requires, as was mentioned again and again throughout this discussion, is a more just a more inclusive and sustainable approach. And with this, I'd like to wrap up this session. Thank you again for our distinguished panelists and speakers that have joined us in this session. From all over the world, we have the Treasury of the United States, Her Excellency Janet Yellen, and Minister of Finance of India, Her Excellency Nirmala Sitharaman, and President of the World Bank Group, Mr. David Malpass, and Senior Minister and Coordinating Minister for Social Policies of Singapore, co-chair of the G-20 high-level independent, His Excellency Tharman Shanmugaratnam. And a big round of applause perhaps for our speakers from the floor in Jakarta. And as well, thank you again for all distinguished participants for joining us in this session. And we hope this session has been fruitful and also enlightening. And stay safe and healthy for everyone. I'm Kanya Sutisnawinata, and at this point, I'd like to close this session by inviting, for his closing remarks, the Central Bank Governor of Indonesia, Mr. Peri Warjio. Please welcome.
Well, the last two sessions is being remarkable. Distinguished Finance Minister, Central Bank Governors, panelists, speakers, ladies and gentlemen. Before we closing, let me, on behalf of both Minister of Finance and myself, would like to thank all of the speakers for the excellent presentation and deliberation. Indeed, the deliberation have provided us with a very valuable insights and steps on ways to strengthen the global health architecture, how to better finance export efforts, and how to strengthen finance and health coordination. So what we learned today over the last two remarkable sessions. Let me start with the first session on the strengthening the global health resilience. Tackling the pandemic remains our top priority.